I'm Amanda Olson from Intimate Rose, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And today I'm going to talk about how the Intimate Rose wand or vibrating wand can be used as a tool to assist if you have problems with defecating or going to the bathroom number 2 if you have rectocele. So I'm going to do just a quick review of anatomy here to explain why this phenomenon occurs, and then we'll talk about how the wand can be useful to overcome it. So pelvis is here. Looking over the top view of all of the pelvic organs, we have the bladder in front, the vagina and uterus in the middle, and back behind that is the rectum. When pelvic organ prolapse occurs, the organs in the pelvic bowl, namely the bladder or the rectum, can sink into that vaginal wall. So either in the front from the bladder or in the back from the rectum, compressing into that vaginal wall. And that can happen from straining if you have chronic constipation. It can happen after childbirth or surgery or just different forms of posture, or if you have connective tissue issues where the organs are just not as well supported as they could be, those organs will sink in. It's possible to manage that using other techniques, but today what we're going to talk about is specifically what happens when this rectum compresses into the vaginal wall, making it difficult to have a bowel movement. The first thing that I recommend when having a bowel movement is to use some sort of a prop underneath your feet to get your knees up above your hips. Squatty potty is a great tool to have in the bathroom to help put your pelvic floor at a good angle. For some people with rectocele, it may just work better to have the feet down, but it's always worth propping them up and trying. You can even use yoga blocks or old phone books, things like that, just to get the knees up. So what we're talking about here specifically, so coming into that top view of the pelvis, the rectal outlet here is compressing down into the vagina, and what that does is it can cause a little bit of pocketing of that feces into that space in the vaginal canal. So when you're going to have a bowel movement, it's not an easy, smooth transition to get the fecal material out through the rectum because of that pocketing. So one solution is to use 2 fingers and place it into the vagina. So if this is the vaginal opening here, 2 fingers into the vagina, and to just gently compress and sweep downward while you relax the pelvic floor muscles to help get that fecal material out to have the bowel movement. If that's not working for you, what's really helpful is to use one of the wands. So whether you have the vibrating wand or the regular wand for dealing with trigger points and other sorts of myofascial release within the pelvis, you can use either end to help provide that scooping maneuver. So if this is the pelvic bowl here, you could use the long end here coming in just like this into the vaginal opening. So you would insert it into the vagina and provide just a downward scoop and sweep, almost like you were going to just push toothpaste out of a toothpaste container. And what that does is it presses down on the rectocele to help empty that rectum during the bowel movement. You could also use the pointy end here, and then you would flip it like this so the tail is up. Here's the vaginal opening. In comes the pelvic wand into the vagina, and you're using it to scoop down like this to help clear that pocketing of the rectocele in the vaginal wall to get the bowel movement out. For more information, don't hesitate to email us at support@intimaterose.com, and for more videos, you can see our website.